I welcome all homeopathic students, interns, postgraduate students, and practicing doctors who are joining me live today. Let us me ask you one simple question. How many of you have studied homeopathic materia medica again and again, but still confused while prescribing in OPD or clinical practice? How many of you know remedies, but you fail to recognize the patient sitting in front of you? And how many of you feel that materia medica is too vast, heavy, and difficult to revise? If you feel this, you are not alone. And this exact confusion is the reason why this live series exists. For those who are new to my channel, I am Dr. Yogesh Salunkhe, practicing homeopathic physician since last 20 years. Over the years, while practicing, I realized one important truth, that materia medica is not a problem. The way we read it, it is a problem. Most of the students of materia medica read it like a dictionary or read it like a novel, but patient never comes like dictionary or like a novel. So this live series is not about memorizing the symptom. It is about the learn how to think clinically, or how to think in way that the patient is in front of you and you are prescribing. My aim is simple. By end of this series, you should able to say that I recognize the remedies in real patients, not just for exam, but for a daily OPD. Confidence that your confidence while prescribing is going good. So in this series, I will discussing one remedy for one session, and the book that I will referring, or the book is the main of that series, is the Phatak. So Phatak's Homeopathic Materia Medica is the main book that we are going to analyze in each lecture series. Now the most important question is, why Phatak? Why not Kent? Why not Boric? Why not Allen? Let us me answer this very honestly. Phatak is a clinical materia medica, not a descriptive. Most clinical books, most materia medica books are descriptive, but Phatak materia medica defines remedies in detail. Phatak does not tell you everything about the remedies. He tells you what is essential in that remedy and in clinical practice. Essential symptoms that symptoms that decide the prescription. So one story behind that, from in college days, I will used to read more about Boric Materia Medica Allen's keynote. But one of our teachers, Dr. Inamdar sir, he every time tells us that read Phatak repertory. But I used to ignore it. When I started my practice in 2005, one of patients of mine who is around 96 years old, Mr. Pawar. He used to live in Mumbai, and in his young age, and in 2005 he lives with his retirement life with his in his native place in Fulton. And in my desk it is a Phatak's Materia Medica put, and I was reading, and he came, we started consultation, and he saw the picture of Dr. Phatak, and he eagerly explained that ये तो फाटक सर है, he is Phatak, Dr. Phatak. So he tells the story about him, that at the age of his 36, 38, his wife is of 35 years age, and all doctors from Mumbai, big hospitals, said that he is not giving to birth to any child, and they were disappointed. and then he is a barber by profession, and Dr. Phatak used to come for shaving to shaving, doing shaving to him. And once he just asked Dr. Phatak that my wife is this problem and can you help me. Then they Phatak sir came, asked them to come for consultation. They give some medicine. After that, he gave birth to four children, and in his all children are good. And at the age of 90, both couples are coming for consultation in 2005 to 2010 to me, and he said that he is a god for me and he is a miraculous man. Then I started reading Phatak. Then after many more years, I recognized that many of international softwares, many of references or many of books bibliography mentions that Phatak Materia Medica is one of them. So they refer as a first line book for their all materials. Then I got mind that if Phatak is in India and he is the modern clinical master, he is MBBS. Then he started after his story is different. I will tell his story of conversion of homeopathy in another next part. But he then started practicing allopathy, then started converted to the homeopathy and has a huge practice. And some of now's modern masters have seen his practice. So he's a local guy from India who practiced around 40 to 50 years with huge OPD and huge clinical knowledge. He write only two books. That is, one is his Materia Medica, another is his repertory, and both books are in English and also in Marathi. So it is important that he is a local and he sees many patients. So I started more studying Phatak Materia Medica and repertory, and which helped my practice. So for help to other practitioner, this series is started. Phatak teaches remedies in personality. Phatak does not gives you long stories. He does not gives you long sentences. He gives only sharp clinical identity. When you study Phatak properly, you stop seeing symptoms and you start to seeing the patients. And homeopathy is a not seldom based medicine. It is a personality based medicine. It is not symptom based medicine. It is a personality based medicine. So Phatak Materia Medica is OPD oriented. In busy OPD, you don't have 1 hour to analyze case. You need to have a quick observation, and within a few minutes you have to prescribe the patient. So clear differentiation and confident prescribing. Repeatedly reading Phatak Materia Medica, different angles of remedies have been come in front of me. Phatak trains your mind for exact situation. Phatak is also for exam and practice friendly. For students preparing for BHMS or MD exam, Phatak gives more clarity. For practitioner, Phatak gives more confidence to us. That combination is rare and a handy book. How this series will be different, so that I want to make one thing very clear. This is not a book reading session. This is a session where I will not read lines from Phatak, but I will decode the Phatak, or I will read in between lines of the Materia Medica, explain you in a simple language, and adding my experience, or adding experience from the many teachers I learn homeopathy. So it is a quite interesting journey for all of us. In this series, how to understand the mind of the remedies, how to observe the patient clinically, how to differentiate similar remedies, how to avoid common prescribing mistakes, how to apply Phatak in real OPD cases. So this is a live explanation. this series is live because learning homeopathy should be interactive, not one way communication. I encourage you to ask questions in comments. I will answer them live whenever impossible, or I will reply at that time. Your doubts will help other doctors also to grow. So the series of this structure, in each session I will discussing one remedy at a time. This remedy will cover mental picture, physical general, clean note, clinical differentiation, slowly and step by step. Foundation of the each remedy has been built. Constant constantly this live series will going regularly. And uh, homeopathy is a beautiful science, but only when it is understood correctly. If you are serious about the blooming and confident prescriber, this series for you. If you are ready to think, observe, and grow, welcome to this journey. Let us begin our first step in Phatak Materia Medica. Now, in next station, we will start one remedy. From alphabetically, we will starting the remedy, and in that remedy, we will discuss more about the specific conditions, potencies that I use in different remedies for different condition. And so for keep watching next live session, and thanks for watching. Next live session will be as early as possible. I will get time. Thanks a lot.